Hello friends. If you want to reverse diabetes, it is not a big task. First, remove blockages from the mind. Cardiologists do 15 or 20 angiography per day, and they then write down blockages 90%, 95%, 99%, 100%, 80%, depends. Long segment lesion in coronary arteries. That is all without ultrasound, so it is not proper judgment. So remove that fear from the mind. Go for blood test, lipid profile, HSCRP, anti-proBNP, vitamin B12, vitamin D3, lipoprotein A, lipo-B, lipo-A, HbA1c, if you are diabetic, fasting blood sugar, uric acid, serum creatinine, LFT. All these tests are needed to see the picture of the blockage in the arteries. You can go also for anti-proBNP test to see that your heart is working or the heart is failure. That is blood test. So you can do that blood test and go for ECG, and if you suspect that ECG is inconclusive, then you can ask patient to go for TMT. But in emergency, when you have impending doom in the chest or throat or back and perspirate you are going to fall on the ground and your heart rate is racing, then that time is a crucial time, and that time you have to take immediate aspirin or ecosprin 350 milligram, ticagrelor 92 tablets, and atorvastatin 80 milligram 1 tablet immediately, and then call 911 in India, and they measure your blood pressure and pulse, and accordingly they give you sorbitate for temporary relieving of the pain or injection morphine. Then immediately you can go for thrombolytics to dissolve the clot. If you are partial occlusion of the artery, then thrombolytic is not needed, but total occluded artery, ST elevation, then thrombolytic, fibrin-specific thrombolytics like retaplase, tenecteplase are good, very good. They are 40,000 rupees injection. One push in the tenecteplase, 5-second push, or in retaplase in half hour, 2 doses are given, and clot is dissolved. Either you can go for stenting to relieve the chest pain. Stenting doesn't prevent second heart attack or doesn't prevent death, but to relieve the chest pain acute in crucial time, 6 hours you can do. Otherwise, while you are walking, if you have pain, while you are walking, you have breathlessness, or you have shoulder pain while you are walking, or back pain, that doesn't worry. Block is stable, and that you can. Block is developed in 40 years. Slowly develop, and in that 40 years block, you can reverse it by not only 40 days of lifestyle. You have to take medicines for that. You have to take intensive medical treatment as per clinical trial to reduce your cholesterol below 50 or below 40, keep triglyceride below 60, and keep total cholesterol below 140, and keep HSCRP below 1. Then you can be heart attack proof. But the basic thing is that take alkaline food, that is plant-based vegetarian item, that we doesn't like it naturally. Our tongue doesn't like it. We like wafers, we like all packing items, we like fried food, we like sweets. So we like cold drinks, we like lassi, ice cream. So those who are likely to the tongue is detrimental to the heart. Because plant-based vegetarian items like palak or any bhaji or vegetables, fruits are not likely to in society to the people. They like their taste first. And outside food people are eating mostly, and they don't understand that palm oil is used mostly in packing items, and that is very detrimental. If you take a wafer and burn it and keep one paper below that, you can see that from one wafer, 7 to 8 drops will be on the paper of palm oil. That is very inflammatory and heart attack prone things. French fries, wafers, then junk food like burgers, pizzas are all detrimental. Bakery products is also damaging. Breads, white bread is also damaging. You can use brown bread, but see the ingredients inside the brown bread. See the label that how much starch is used, maida is used, then take accordingly. And take millets and reduce the use of wheat and basmati rice, particularly in diabetic patients. You can have a lot of options like jawar, jai, ragi, bajra, makai. Makai is not advisable for diabetic patients, but otherwise normal heart patients can take it. You can take chana, flour, roti. So it's a person's own choice. But I only say that use plant-based item, means plant-based natural vegetarian item, means that grown on the earth, not factory-based item. Avoid factory-based items. And second thing, do yoga, pranayam for 5 minutes. That is very good to control your sympathetic system. Some people are type A type of personality. They are always in a rush mode, A mode. Always in a A mode, while driving, while doing any work. Unnecessary, some people are horning while on circle. Red light is there. In spite of that, traffic is jammed. In spite of they are horning the vehicle. What is this? That is their inner mind's problem. So keep your mind cool. Take proper sleep, 7 to 8 hours. All these things can reverse your diabetes and heart disease. And diabetes also you can reverse by new generation medicines, gliptins, SGLT2 inhibitors, semaglutide for obese patient. But if you are not obese, if you are not diabetic and obese, don't take semaglutide. Like this one Ozempa or Victoza, or don't take if you are not diabetic but obese to reduce the weight. If you are diabetic and obese, you can use it, doctor prescribe it. But without diabetic and obese, to reduce the weight, don't use these tablets, Ozempic or Victoza. That leads to a lot of side effects. So this is basic, and walk as per guidelines. Do aerobic walk, cycling, walking, use stairs, don't use elevator. But this is not happening in day-to-day life. So my suggestion is that everything you do is to calm the mind, relax the body, don't be in a confrontation mode, and don't be a type A personality. Eat plant-based vegetarian diet, take medicine properly, and walk as per your conveniency, and take proper sleep. Avoid any bad habits like gutka, cigarette, bidi, tamaku, alcohol. Alcohol is not needed in India. Some people say that French people are daily drinking wine, but it is their genes are prone to that, acclimatized to that. We are not acclimatized to alcohol. So binge drinking and over drinking is very bad. I say mild drinking is also very bad for heart patients, because it leads to weakening of the heart and increase of triglycerides, so blockage will increase, hypertension will occur, so avoid it. So it is a comprehensive approach, and I finally say that there are a lot of EECP centers, and some doctors has make EECP as a money earning facility, like in hospital bypass and angioplasty in stable condition are doing for money earning. Emergency, if you go for angioplasty, it's okay, but unnecessary angiography, angioplasty and bypass in stable condition is money earning facility, that is slaughterhouse. Such in India, there are a lot of doctors from Delhi, from different states, who say no oil diet and give unnecessary advices. But these people are giving franchisee to 100 centers and non-medical people, and they hire homeopath or allopath. I am not saying bad about homeopath or allopath, but EECP has special course to learn how to give EECP. So what these people are doing, they do nothing. They give EECP just as a placebo. They are not treating the patient. EECP has special training session, when to give inflammation, when to leave inflammation, and how much pressure is needed. Heart failure protocols are different, normal pumping protocols are different with blockage patients. So it is. I am a member of International EECP Society, and I have cleared exam, and I have certificate of EECP training, online and ground training. Then I am doing EECP practice. I cannot say I am a MD or a DM, so I can do EECP. Because EECP is a very deep science, and it has to be understand basically. Right now what is happening? Right now it is a time of social media. people see ranking of the rating of Google rating, what happens? Though some organizations I don't name, but some wellness center or some organization uh, intensely hire professional reviewers who give negative reviews to uh, opponents, means competitor. Like my center is Heart and Vascular Care Advanced ECP Center. So my competitors are a lot of in Ahmedabad. Okay, that is, you can say, I am not saying that all are uneducated, but uneducated and educated. They spent money and give money to reviewer and downgrade my business because my center is running due to my work. Uh, what is happening when we go abroad or anything? We see a review of hotels. This hotel has good review. This good, but when we go there, I had experience. I go to USA in 2023. Uh, it was my third visit. So review wise, it was a wonderful hotel. 5 reviews, and I booked by SBI card. After reaching there, I see that that was a casino and very low grade hotel. Immediately SBI has blocked my card in America. I was in dilemma that what to do. So I have on WhatsApp uh, my relative has sent card, and I give card number to the another hotel I shift, and I stay at America. So reviews are always professional. They give money to their increase their reviews so people can come to their hospital and make bread and butter and give money to downgrade other competitors' reviews. This is a very filthy scenario coming nowadays all over the world. And 2 days before my I have 2 centers in Ahmedabad, ECP, advanced ECP centers, heart and vascular care. Suddenly, one organization, Soul or something I don't remember, and one wellness organization, suddenly maybe they people because they are without work and they have to do this heinous activity. Suddenly, my review from 4.9 to 4.3 done. Suddenly, within 3 minutes. And I have seen that all the professional people have downgraded my review by giving negative star, single star. I'm surprised. What is happening? And if you complain Google not listening, just dial not listening. So it is a big game in a business, in every business. Competitor downgrade by hiring the reviewer and increase their reviews. This is a very filthy practice nowadays. So be aware of this unrealistic reviews, because it is a scam, big scam, and visit personally to the consultant or any business center, because in reviews we get assumption, we make big, by seeing good reviews, but we get bad results because they have no work, so they only do this type of work, review rating work. So review raters are earning more than nowadays than business owners because they take hefty charges maybe, because I am not doing that, but they take hefty charges. In Ahmedabad, one wellness center has a opening of 3 or 4 years, and he has a review of lot of uh, 4.9 reviews, and 1.6 million people has given him review. In 4 years, 3 or 4 years, such a patients you have, such so much patient you have seen and treated. So this is all scam. One sour company is also doing such type of activities of giving bad reviews because of non-running of their business, and harass the competitor, those who are working on the ground level and to treat the patients like me. And this review scam in a medical field is a very, 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 very nasty thing, very bad thing. God bless. God bless.